I'm Lisa Preller. I'm one of the midwives at Albany Obstetrics and Gynecology, and welcome to your virtual tour of the hospital. The first thing I usually talk about in the tour is where to park, and things are changing, as you know, here at St. Peter's Hospital during COVID-19. But typically, so why don't we walk this way? Actually, come on over here. Typically, you know, you park in this garage, which is typically open between 8 and 5 or so. But I don't believe that you're going to have access to park in there. So you're likely going to have to park over at the valet entrance because the hospital has limited access right now. So let's take a walk. If you just look over there, there's the main parking garage. Not quite sure if that's available either. I believe it is, but then the bridge going over to the hospital is closed. If you look over here, this is the only entrance that's currently available for you to go into. You're not going to go in through the emergency room. We generally advise you to stay away from the emergency room. So whether it's now or a year from now, this is the entrance that we like you to go into. So let's go do that. So when I give our tours, I usually say to park here. And most women go into natural labor, not during 9 to 5 hours. So the valet is not available. So women typically, couples typically come and they either leave their car here, or over where those cars are over there. And then once you get yourself settled on labor and delivery, you can come down and move the car. I generally say don't give the keys to the valet because then after, depending on the day of the week, you'll have to get your keys from security. So if you look here, we have this spiral door which is still open. So you go in through that. So let's do that. So 24 hours a day that's open. If that happens not to be open, there is this door over here, and there is a panel that's open 24 hours a day for you to come in. So I don't want you to worry about getting into the hospital, whether it's at 4 in the morning or the afternoon. We're a 24-hour operation. So if you want to just take a look here, this is the main entrance of the hospital. What I normally say is when you come into the hospital that I do want you to walk into the hospital. If you feel that you can't walk when you're laboring, there are typically wheelchairs. So typically there are several wheelchairs over there. So if you feel that you can't walk up to labor and delivery, grab a wheelchair. Partners, dads, who's bringing you into the hospital, you grab one of those wheelchairs and you just go on out and get laboring mom. So come on up, we're going to walk on up. So this is the next step of our tour. And typically, if you're walking up the stairs, this is where we land. This is kind of the main corridor of the hospital. If you do take use a wheelchair, you would take the elevator up, and this is where it would drop you off. When the bridge is open, come on over here, which is, I don't think it's open for visitors right now. You would park in the main garage, and you can see the bridge is what connects you to the main corridor of the hospital. So what I usually say is when you speak with one of your midwives, they're going to tell you exactly where to go. And I always remind patients, go to the 3rd floor labor and delivery. And I'm sure all of my colleagues do the same thing. What I also say is make sure you call us. We do like to talk to you before you come to the hospital, and we make that decision together as to when you come to the hospital. That way we can notify the hospital staff and they'll be prepared for you. So come on, let's go grab an elevator and we'll go up to labor and delivery. We have food options here at the hospital. We have pretty delicious pizza and boar's head subs over here. Food availability, that kind of stuff. It's changing a little bit right now, but we still are offering food. Our gift shop, I think, has limited hours now, but it is often open. So this is the main elevator section. So you're going to come here and you're going to go to the 3rd floor. So let's go do that. Going down. So welcome to the 3rd floor. This is, we're very proud of everything about this floor, but we had a great year this past year as a hospital. So we had over 3,000 deliveries this past year. Come on into our waiting room. So I usually spend a lot of time in the waiting room. As you can see, it's empty because we have a a significant restriction on visitors right now. This is where I talk to you about visitation in my class, and when I record my class tonight, we're going to go over a little bit more of, what a typical hospital stay looks like and how long you expect to be here. But when the waiting room is open, which it will be open again in the near future, I hope, this is where you have people come and visit and stay, especially if you don't want them in the room with you during your labor and delivery. So let's go and look at a room. So you're going to take a right off the elevator, just walk down this way. On my tour, I always walk backwards. And I then talk about how wonderful our NICU is. So soon the doors aren't open, but you'll be able to see the hallway for the NICU. We have 24-hour coverage for the NICU, neonatologists, nurse practitioners, and neonatal PAs that cover the unit 24 hours a day. Come on this way, I'll show you where to register. So sending in your pre-registration form is really important too. So your midwives typically will give that to you at your visits. It's also online. So if you go on to St. Peter's Health Partners, there is the Women's and Children's, and then there's the education part, and there is an online form for you to pre-register. So we encourage you to pre-register because then they have all of your information about your insurance and that kind of information. Obviously bring your ID, your insurance card when you come to the hospital. This is the registration office. When you come to the hospital, they're in there with somebody right now, but when you come to the hospital, they're going to have you sit down in there and ask you a few questions. During the time of the coronavirus, they're going to even ask you more specific questions about travel to screen you before you go into labor and delivery. If you're actively laboring, they're not going to make you sit in that little office. They're just going to have you go right down to labor and delivery. We are a locked unit, so even when things aren't the way they are currently, you have to know the first and last name of the person that's at labor and delivery. So we buzz you in. So come on, let me show you how to do that. So if you were coming to visit somebody at labor and delivery, you would have to push that entry and just say the first and last name. That's obviously a lot different now, but we're going to go back to normal soon, I hope. Come on in. So welcome to labor and delivery. This is the nurse's station. And behind me are 3 operating rooms. I can't show you those because those are sterile. And oftentimes we have more than one operating room going or operating at one time. The thing I always say at this point is what a wonderful hospital this is for you to deliver at. We have 24-hour anesthesiology, we have 24-hour obstetrics coverage, which means that we have a board-certified obstetrician that can perform a cesarean section in an emergency for any patient. So the St. Peter's Obstetric Group covers from I believe 7 or 8 in the morning till 5 p.m. and then we have another physician that covers and sleeps here until the morning. Let's go look at a room. This is one of my favorite rooms, room 2, so come on in. We'll go take a peek at it. So I'm first going to actually show you the bathroom because I think the bathroom is really nice here. So we have a hydrotherapy tub here, as you can see. And we also, and this is a nice big space, every labor and delivery room has a shower. This is the only room 2, that has the kind of the stationary hydrotherapy tub, but we have the ability to use inflatable tubs in any of the rooms, so don't worry. Let's go out and quickly look at the room. I usually start the room tour pointing to the positions for laboring out of bed. I find that most women, when they come into the room, they make a beeline to the bed, and then they lay down. And as midwives, we say, or at least I say, the bed is the worst place to labor. Most women kind of plop into the bed, and then we have to encourage them to get out of bed. But really, I love that this is in every room. So we do need to do a couple things, which we need you close to the monitor. So let me show you that quickly. This isn't on right now, but this is the way that we monitor your vitals and your well-being as well as your baby's. So we have external fetal monitoring. So these monitors, you put a belly band on that looks like this. Just gonna open it up. And you place this over your belly like a tube top. And then we place these monitors in, and this is how we listen to the baby's heartbeat. Those of you who have had non-stress tests in our office or who have been to the hospital for evaluation or monitoring have had a trial of this. But essentially one of these monitors the baby's heart rate, the other one monitors your contraction pattern. We have two different ways of monitoring your baby's heart rate as well as your contraction pattern. As you can see, these are wired. So these are tethered or attached to the computer. We also have portable monitors, and the beautiful thing about portable monitors are we don't have the wires, and so you can go into the tub, you can walk the hallways, you can change positions in the room. These are about, I don't know what this is, 8 feet, 6 feet, so you have to stay attached to that. So our intention is that we get you attached to the portable monitors. If for some reason you're not, feel free to ask if we're not here for you at that time to be able to get those. What I also say when I do my real tours is that not only can the nurse and your providers see the baby's heart rate on the screen, which I don't have on right now, but they can see it at the nurse's station, I can see it at my office, I can even see it on my phone. So a lot of patients wonder, like, where are you when you're not here? We may be in with another patient, we may be in our office, but we can always see how you're doing and how your baby's doing. We are absolutely keeping an eye on you and your baby the whole time, and part of that is through the monitoring. But then I also say, if you're low risk and you go into natural labor, you don't need these monitors on the whole time. So when you get admitted, we definitely want to see how you and your baby are doing and tolerating labor. But if all of that looks reassuring, we can do what's called intermittent fetal monitoring. So you can, assuming things look fine and you're low risk, we don't have to monitor you and your baby the whole time. And we encourage you to kind of get up and walk around and use the shower and use the tub and use other options for laboring in your room. The other thing I say in the tour is this is the baby warmer. And then I go on to say the best baby warmer is you. So most deliveries that we attend, the baby comes out of your body, you work very hard to push that baby out, and then we put that baby right on your skin, because your skin and your temperature is what keeps that baby nice and warm and helps that baby transition, because it's hard to be born. And so we definitely want that baby on your skin if that's something that you want. If the baby needs some extra TLC, this is where the baby would get it. For every delivery, we have another nurse in the room, and depending on the needs for that provider and the nurse, they may have someone from NICU here, someone from respiratory therapy here. So this is where they would give your baby care if it was needed, and then quickly try to get the baby back onto your skin. When you come to the hospital, this is what you're going to be given to wear. What do you think of that? So you can wear whatever you want, to be perfectly honest. This is when I tell the story about my delivery, but I don't think I'm going to do that right now. But I wore this, but by the end of my delivery, it was off because I was sweating and hot, and this felt very cumbersome for me. If you want to bring your own clothes in, I had a delivery the other day where a woman wore this really nice kind of loose dress, tank dress. I think she ordered it online, but it was open in the back just in case she had decided to get an epidural. If you do labor naturally and you don't want pain relief, specifically an epidural, it's fine to wear whatever you want. If you do wind up getting an epidural or needing a cesarean section, we need you in this because it opens in the back. And that's where we need to get to you if you get pain relief, if you get an epidural, which we'll talk about in my childbirth class. And we're going to quickly go look at the postpartum unit, so come on along. Prepare to be in labor delivery 90 minutes after you deliver, and then they typically want to transition you over to postpartum. So that's where we're going now. So similar to labor and delivery, the postpartum unit is a locked unit. So when you come and visit, you have to push this. As far as hours, labor and delivery is 24-hour visitation, and we all know that visitation is slightly different right now. But postpartum is 9 a.m. to 9 p.m. So they're very strict about that, and the point of that is to allow the moms to rest. So this is a very big, beautiful unit, and I'm super proud of this unit. And there's so many resources here for you too. There's lactation, the nurses are amazing, the support staff is amazing, dietary is amazing. Let's go look at the nurses station here, and then we'll go look at a room. So this is the nurses station. So after you're buzzed in, you will need to sign in. Again, we know that visitation is slightly different right now, that if the partners do come, they need to stay with their partner the whole time and leave when they leave with their baby. But that's not going to be that way always. So let's go look at a room. So come on into a postpartum room. They all look pretty much the same. I'll show you the bathroom. This is where the partners typically stay over here. And this is the bed. I've stayed in, what I usually say in the tours, I've stayed in worse hotel rooms, so I think these are really beautiful rooms. So you're here for 24 to 48, maybe 72 hours, depending how long you're here. That's the postpartum room. Thank you so much for coming on this tour with me. We are trying to meet your needs during a time where I can't show you personally the hospital. And any questions, anything you need from us, please reach out to us. All the midwives and nurse practitioners and physicians at Albany OBGYN are here for you. Take good care.